The second wave of COVID-19 infections is well underway in South Africa with a record-setting caseload. The number of deaths also continuing to rise at an alarming rate, now approaching 30,000, with the cumulative caseload now at well over 1 million. Government yesterday announcing a COVID-19 vaccine rollout plan to stem the tide of rising infections. Let's unpack that story, a number of issues we would like to unpack with Health Minister Dr Zweli Mkhize, who joins us now live. Minister, once again, thank you so much for your time this morning. On the AM report, I think yesterday's briefing, really a welcome briefing for all South Africans. There's been so much talk around the lack of clarity on our vaccine rollout plan. You're now saying, Minister, that you're hoping to see at least the first phase of vaccines hitting our shores by February. That's certainly a lot of good news for the country. What is it going to take to make that aim of February a reality for us?
Well, firstly, we have indicated, President indicated that we would expect that our vaccine should be here no later than the first month of the second term, which is April. It was mainly based on the fact that currently COVAX facility that had, in which we are subscribed indicated that timeline. Now we are working very hard to bring that date closer, and therefore we are talking to a number of manufacturers who are indicating various issues which we are not at liberty to quote at this point, but that we are pushing for an earlier availability. So what it will take is that firstly, we should be able to get an agreement with the particular company that it will be able to deliver. For us, what is most important is how quickly can you deliver? And when they say that's the timeline they can give us, then only we are able to say, okay, on that basis, we should be able to procure from that particular company. So that is the real focus for us. And of course, there are other issues that we have to consider. The question of the logistics associated with the administration, the storage issues are very important as well to bring about a successful vaccination. However, our major issue is that the availability should be the main issue. Some of the companies are indicating that they are ready to sell us some of the vaccines, but they can only do so maybe late in 2021. So we have to now skip those and so on. So that's the kind of negotiation that we're involved in.
Yeah. Minister, a lot of criticism coming from various quarters, among them political parties, in the wake of your briefing that you held yesterday on our vaccine rollout plan. Criticism that government, it appears, still doesn't have a detailed funding distribution plan, that it's very late now in the game to now be talking to manufacturers about securing a COVID-19 vaccine. Is that a fair criticism, Minister, that we are lagging behind in our action when it comes to securing a vaccine and doing so timeously?
Well, for us who are involved in the assignment to make available the vaccine, it's not a criticism that we think is really well-founded. We have been involved in this discussion for quite a long time. You know, most of the countries that are already supplying the vaccine were actually, they started procuring and paying for the vaccine much earlier, even before we knew which of these vaccines would be successful. They have the latitude of availability of resources to take a risk and then hedge on various vaccines, which we couldn't do in South Africa because we don't have so much of resources. And therefore, by the time the results came out to indicate that there would be a number, at least about 9 or 11, that could be considered successful, that got a chance of being successful, it was much down the line. They'd already committed a number of companies to supply for themselves at that level. So I would say that when we started to engage these companies, we are in a situation that if we can find some of the vaccines, we should be able to start vaccination in time to be able to join the rest of the world on the early part of this year. So we can always get a criticism, but it doesn't have to be a well-founded criticism. As in this case, I think there's too many complexities that people who are outside are not able to appreciate.
Yeah, sure. I mean, Minister, this issue around us now negotiating directly with vaccine manufacturers outside of the COVAX facility. Just explain to us, Minister, what does this mean for us? We've now paid a part of that COVAX deposit, haven't we? We haven't paid the entire deposit, as far as I know, but you will correct us, Minister. What does that mean for us? Will we then still be looking at COVAX for vaccines, but we're also negotiating directly with manufacturers? Does it mean we now have these two different streams, and whichever gets us the vaccine earlier, that is the one we will focus on?
No, actually, it's a matter of numbers. So COVAX was going to give us a foot in the door to be able to say we can start vaccination as soon as that is possible. Now, we didn't know how long it would take for the different companies to produce. We didn't know exactly how much of the vaccines we would have needed. All of that is a bit more clear now. So, for example, we paid for COVAX is going to procure 10% of our needs. So it means it will only cover just under 6 million people. So that is not enough to cover the minimum number of people who need to be vaccinated to get herd immunity. And that number has been calculated by our team, our scientists, as 67%, which is about 40 million people. So beyond the 10%, we need to still look for additional resources. So the two will go together. Our initial hope was that COVAX was going to come in early, and therefore would be able to use COVAX to actually attend to the high priority population. But now we also are saying whatever time COVID reaches us, we must try other means of getting additional vaccines, because the quantum that is needed is going to take us to about 40 million people. Yeah. So the two will go together at this point.
Thank you for that clarity, Minister. In terms of the funding for our vaccines, we struggled, it would appear, to pay our deposit for COVAX. How will we find the funding when we are talking directly and hoping to buy directly from manufacturers? Minister, can you give us a breakdown of the money that is needed and the money that has been set aside for our vaccine rollout plan?
Well, the COVAX facility, we targeted 10% of our population, and that was something that will cost just around 2 billion, 2 billion rand. But we had to put up a deposit of just under 500 million to COVAX. Now, because of the cycle of our budgeting cycle, it was not possible to go and find new money from the budget that has already been tabled, because it had not been included earlier. So for that reason, we got the Solidarity Fund to come in and put the deposit when the rest of the money is coming through the fiscus, which will be now already in the New Year's budget. So that allows us now space to commit the money, but at the same time deal with the deposit that we were to pay. Now, the additional requirements require us to find a partnership in the financing. And so we're looking at government putting additional funds. We're looking at private medical schemes making a contribution. They would, in any case, have had to make some contribution. And then we're also looking at private sector coming on board. It's a very unique opportunity for all South Africans to work in partnership, where we're all providing resources for the benefit of all South Africans on a social solidarity principle that, whatever resources we have, they are made available for those who are in the highest need, and therefore it will cover everyone in that kind of manner. So we would then, at this point, we have discussed with the medical scheme that they would put some funds, and then, of course, there will be cross-subsidization for additional vaccines for the rest of South Africans, and therefore the combined pool will be a combination of private sector medical scheme as well as government. That together will give us the amount. Now, we're not able to give you a specific global figure to say this is how much it's going to cost, because we are negotiating with a number of companies. Their cost structures are different. So once we have got that finalized, we'll be able to announce everything to the public.
Yeah. Minister, in terms of the clinical trials that we have been a part of here in South Africa, you know, we thought, as ordinary South Africans, we thought that that would give us a leg up in terms of making vaccines more available to our population, because we had made our people available for those clinical trials. But that is not the case, is it, Minister?
Well, there are lots of considerations to put into practice the whole distribution of vaccine or procurement of vaccine. Firstly, the trials that were conducted in South Africa allow us the possibility of information that makes it easier to register the particular vaccine in South Africa. The fact that we have participated also means that, in principle, the manufacturer has an obligation, a moral obligation to the people of South Africa who have offered themselves as part of the broader investigation of the vaccine, and therefore they cannot just be ignored. So that would be the issue. However, the procurement process is a government to a manufacturing company arrangement. It does not go via the researchers or those particular trials that would have gone through. It certainly means that government has to go and negotiate on a commercial basis on the fact that each particular company has to agree on various terms, on various prices, on various quantities with the government. It does not take into account whether, in fact, there was a trial done or not, but what the availability of the vaccine has to take into account that you cannot have a country that participated completely excluded. But in terms of whether we would choose that particular vaccine, it depends on the issues of efficacy. Once that has been established, then the issues of various conditions such as the price of the vaccine and other logistical issues that are associated with the cold chain issues and the ease of administration. All of those issues have to be taken into account. So there's nothing that's a straight line. We did a trial on such a vaccine. That's the one we're going to only deal with. But we are saying that we have to examine it's like going to a particular sale and pick up the one that's most suitable for us. And then, of course, we'll use the leverage of the fact that we did have a trial conducted in our country. Similarly, even the question of manufacturing in the country, if there's a vaccine that's being manufactured in the country, it does not follow that that vaccine is manufactured for South Africans. It may still be a vaccine manufactured for the benefit of the rest of the other parts of the world where the company is already committed. However, there's a moral obligation to say you can't leave a country which has already made a contribution and not give them access to the vaccine. But there's a leverage that we've got. It doesn't necessarily mean it's a straightforward commercial transaction based on the fact that there was either a trial or a manufacturing. It's a leverage, which we're using as well.
Health Minister Dr Zweli Mkhize, it's always a pleasure talking to you. Thank you so much for your time this morning, sir, here on the AM Report. Some issues being ironed out there.